Good evening, everyone. First of all, I thank the dignitaries for giving me the opportunity. So, what is APROP? APROP is a rapidly aggressive form of retinopathy of prematurity, and the clinical features are characteristic and different from the classical ROP. The disease may rapidly progress to stage 5 ROP if not treated in time. What actually does a APROP patient look like? He has capillary loops. He has capillary loops, which are these loops which do not progress further. There will be an avascular retina. Then there is dilatation and tortuosity of the retinal vessels at the posterior pole, along with vascularization at the junction of the immature and mature retina. Why is it important? Because unlike the other stages, staged ROP, APROP directly goes into stage 5 and the patient may have blindness because of the undetected APROP. When we are looking at APROP, there are two zones which we have to look in. Those are the zone 1, which is the central zone, which is a central zone which is marked by the radius of distance between the optic disc and the macula, double the distance if you take, that is called the zone 1, and then zone 2 is the distance till the nasal ora serrata, and zone 3 is a small peripheral swivel which is present in the temporal ora serrata. So these generally the zone 3 usually forms by 44 weeks of birth. So these preterm babies who are born much before, they are they will have lot of immature retina, which is, and they all are also susceptible to lot of turbulent early neonatal period, because of which they may develop ROP. ROP occurs usually in two phases, in which they have initially their relative environmental hypoxia in the phase 1, which is between birth and 4 weeks, because of which there is vasoobliteration and hypoxic peripheral retina, and because of this hypoxia in phase 2 there is a secretion of VEGF and insulin like growth factor 1, which leads to neovascularization. What are the risk factors for ROP? Early gestational age, birth weight, usage of supplemental oxygen, usually unmonitored, and sepsis, infections, intraventricular hemorrhage, patent ductus arteriosus, hypotension are other risk factors which are seen. What is the need for this study? Because of the improvement of the neonatal services, there is a better survival of smaller babies which we are seeing. That means there is an increased risk of number of babies who are at risk for APROP. So we had done a retrospective observational study, and the purpose of the study was to study the demographic features of preterm babies diagnosed with APROP. The place of study is Nilofer Hospital, which is a government affiliated, and it's a tertiary care pediatric center in Telangana. And since we have all the sick babies being referred in the last stages here, we have a lot of babies who are sick and who have all the risk factors for developing APROP. The study period was from March 2020 to April 2021. Babies who were born before 37 weeks and babies who were born at term but who had a turbulent early neonatal period were screened. The screening was done by half diluting tropicamide phenylephrine drops with 50% with carboxymethyl cellulose. Paracaine was instilled prior to examination, and screening was done with the help of an indirect ophthalmoscope and 20 diopter lens. We included only APROP in this study. Staged ROPs, mature retina and immature retina were excluded from the study. The demographic features which were analyzed were the sex, birth weight, gestational age at birth, age at first screening, and age at the development of ROP. Whenever there is an ROP, it is an emergency, and the treatment management options include anti-VEGF or laser, and sometimes you might need to give both anti-VEGF and subsequently do a laser, depending upon how the baby is responding. We had screened 660 babies during the study period, and out of these 47 babies had APROP, that constituted about 7%. The incidence of APROP was more in female babies, which constituted close to 62%. The mean gestational age at birth was 30 weeks with a range of 25 to 34 weeks. Most of the babies were screened within 1 month, and the post-conceptional age, mean age at the development of APROP was 34 weeks, and supplemental oxygen was given in 23% of the patients. 38 patients were given anti-VEGF, 2 patients were given both, and laser was done in 7 patients. If you see incidence of ROP across various studies, it is in India it is around 4 to 5%. This is the limitation of our study, that we do not look into all the neonatal risk factors, and the clinical implication is that APROP is the clinical emergency. When detected, you have to treat the baby within 72 hours because you have to avoid retinal detachment. These are the acknowledgements. Thank you.
In history, did you take any while testing the babies? Is there any specific you are telling that female babies are more in your study? Is there anything related to that?
Nothing
Gender
very
related.
specific, ma'am, what we have seen, but usually the survival of the babies, sicker babies, it is usually seen as among the babies, these were the ones who were smaller in size, and these were also few of them were twins, and these were the ones who were having the lesser weight. So that's why there would be, and this sample size is a very small sample size. We studied over a very small period. Maybe if we study over a longer period, maybe the gap would have been come down. But otherwise, we didn't find anything much different.
Vijay Lakshmi.